Can advanced imaging improve juvenile osteoporosis diagnosis? Imagine a young person experiencing unexplained bone pain or fractures. Diagnosing juvenile osteoporosis can be tricky, but recent advances in imaging technology are helping doctors get clearer answers. Juvenile osteoporosis is a rare condition that weakens bones in children and teenagers, leading to fractures and sometimes deformities. Early and accurate diagnosis is vital to prevent long-term problems and start effective treatment. Currently, the main tool for diagnosing juvenile osteoporosis is dual-energy X-ray absorptiometry, or DXA. This test measures bone mineral density and compares it to what's normal for the child's age and sex. If the results show a Z-score of -2 or lower, especially with fractures, doctors often diagnose osteoporosis. However, DXA has some limitations. It provides a two-dimensional image, which can underestimate bone density in children who are shorter or have delayed growth. Also, movement during the scan can affect results, and anatomical differences can sometimes lead to inaccuracies. To detect fractures, especially in the spine, doctors often use conventional X-rays. These images can reveal vertebral compression fractures that might not cause symptoms but are signs of osteoporosis. But X-rays expose children to higher doses of radiation and can sometimes produce images that aren't perfectly clear, depending on how the child is positioned or how they breathe during the scan. This is where advanced imaging techniques come into play. Vertebral Fracture Assessment, or VFA, is a newer feature available on some DXA machines. It allows doctors to look for spinal fractures while also measuring bone density, all with much less radiation than traditional X-rays. Studies show that VFA can reliably identify moderate to severe vertebral fractures in children, making it a useful tool for routine screening, especially for kids at higher risk. While VFA improves detection, it may not catch very mild fractures or provide the detailed images that traditional X-rays can. Sometimes, doctors might use both VFA and conventional radiographs to get the most complete picture. Other advanced imaging options like quantitative computed tomography, or QCT, and magnetic resonance imaging, or MRI, are mainly used in research because they are more expensive and less widely available. MRI can be helpful for detailed views of vertebral fractures but is not a standard part of clinical care for juvenile osteoporosis. Overall, integrating advanced imaging methods, especially VFA combined with DXA, can make diagnosing juvenile osteoporosis safer and more precise. They help detect bone loss and fractures earlier, with less radiation exposure. This means children can receive timely treatment to strengthen their bones and prevent future problems. But it's important to remember that imaging is just one piece of the puzzle. A thorough evaluation by a healthcare professional experienced in pediatric bone health is essential. The choice of imaging should always be tailored to each child's specific needs, taking into account their overall health and risk factors. For families living with juvenile osteoporosis, these technological advances offer hope for better, safer diagnosis. Early detection allows for better management and improved quality of life. As research continues, we can expect even more refined tools to help doctors diagnose and treat this condition more effectively. Always consult a healthcare provider for personalized advice, and remember that each child's situation is unique. The goal remains to use the best available evidence to support healthy, strong bones for every young person affected by this condition.